Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Good morning. I'm Dr. Gil Lederman, and I'm here with John Taransky.
Good Saturday morning, New York.
We're here with a new radio program called Radiosurgery Hour. Our goal is to bring you the latest update in health, cancer treatments, answer your questions, have world-renowned experts here on the program to answer my questions, to talk about research, and to bring you the latest in medical care. So feel free to call. We're at the ABC studios, WABC, in New York City, broadcasting live. Our number for your questions is 1-800-848-WABC. Again, that's 1-800-848-WABC or 1-800-848-9222. Good morning, John. How are you?
Good morning, Dr. Lederman. How are you?
Fine, thank you.
Great.
We're leading off with research that doctors read to establish their education for advising patients and practice. And one of the latest studies is about selenium and prostate cancer. Many men have been taking selenium for prostate cancer. I'm not a salesman for selenium. I'm just trying to sort through the data to advise patients. What do I do, doctor? Should I take selenium? Will that help reduce the risk of prostate cancer? And there's a new study out from Holland, which actually took and evaluated the amount of selenium in finger and toenails, and then related that to the incidence of prostate cancer. So some people had studied the amount of selenium in blood. And selenium in blood is a recent measurement of how much selenium is in your body. If you measure selenium in a toenail or a fingernail, it actually measures it over months and months. So it maybe gives a better estimate of how much selenium has been in your body. And researchers in Holland evaluated 58,000 men aged 55 to 69 years of age. And in that group were 898 men with advanced prostate cancer, stage 3 or stage 4. Stage 4 prostate cancer means the cancer has traveled. It's usually gone to the lymph nodes or the bones. And at that time, the chance of cure is less. And so they evaluated the selenium levels in the toenails and tried to correlate it with the risk of having prostate cancer. So first of all, the amount of selenium in men measured was 0.549 micrograms per gram. People who had advanced prostate cancer had lower levels, 0.527 micrograms. And the men with the highest amount of selenium in their toenails had actually a 59% reduction in the risk of developing advanced prostate cancer. So this is a kind of basis where it gets in the literature. If you take selenium, it might protect you from prostate cancer. So doctors haven't done a real study saying, here's 50,000 men, half of you take selenium and half not. What they've done is just measure how much selenium is in the toenail and seeing what's the incidence of having advanced prostate cancer. So this study was published in the American Journal of Clinical Nutrition. You can look at it. It's also was published in JAMA. There's a study in JAMA, which is the Journal of the American Medical Association, which actually shows no improvement in reducing prostate cancer risk. So it is somewhat controversial. There's not a definitive diagnosis. Selenium is an important part of our body, and we need selenium. This toenail study may be a great study, maybe just a random study that doesn't tell us much what to do. Some companies probably get rich selling selenium and make people think that they need to take it. Other people will read the JAMA study, which says there's no benefit in taking selenium.
Now, should the average male consult his doctor about levels of selenium?
I think that's a great idea.
Okay.
And they can also go right to the medical journals. Sometimes if you read the medical journal yourself, you can go online with the references I gave you. Look up and see yourself. Are you convinced? Is the cost worthwhile? Is it controversial? Is it so controversial that you don't want to do it? Is there a downside of taking selenium?
Okay.
And I think it's good for the patient to actually research things and understand things themselves. There's a lot of risk ratios, like why did the JAMA study show no benefit and why did the Dutch study show an apparent benefit?
Sure.
So it's something, I don't know. What do you know about selenium?
Not a whole lot, doctor, and that's why we're here this morning.
Have you ever heard of selenium before
No,
today?
not at all. I can't say I have. So this is news to me.
So what happens if a doctor comes and tells you the Dutch study shows you can have a significant reduction in prostate cancer?
I'm going to pick up the phone and call you, Doc. 212 choices. Is that correct?
That's our number. You're welcome to call anytime you want.
Sure. Yeah, I had no idea of the terminology to this, and selenium. And being a man myself, I'm on the younger side, but certainly it's important to know what's out there and what doctors are talking about when it comes to your health.
What does it mean to you when you get one study that shows one thing and another study that shows an opposite?
I guess it comes down to trust. Do I trust my physician? Is their opinion of how they want to proceed comfortable with me? I'm not really sure, and that's why I leave it to the experts, the doctors, to you, Dr. Lederman.
So what do you do when you have two studies who are good studies? JAMA is a very reputable journal saying no benefit. The other Dutch study with 58,000 men, so they did a lot of work.
Yeah, 50,000 people is certainly a high volume to study. I guess, honestly, doctor, I would consult you, and in your opinion, what path or what alley I should take at that point.
There are diseases and there's situations in medicine where there's actually no one opinion.
Okay.
And some people come on one side. Some people say, well, the downside of selenium is not very much.
Yep.
You have to buy it. There's a cost. And do you want to really spend those big bucks?
Gotcha.
Okay, so we're going to talk about some other topics. Another topic in the news, and it was published in a journal called Oncology Times, looked at whether people who have lymphoma should get CAT scans. So a lot of us say, wow, if you have cancer, you should get CAT scans on a regular basis, maybe every 6 months. There's a cost to CAT scans. There's radiation exposure to CAT scans.
Right.
And what's the likelihood of actually having an improved diagnosis or circumstance with CAT scans? And there's a recent study that evaluated this, actually. They evaluated 644 patients over 7 years. It was published data. The patients all had lymphomas, non-Hodgkin's lymphoma, B-cell lymphomas. The average age was 63 with a range of 18 years to 92 years. Patients were followed up 59 months, so that's about 5 years, with a range up to 116 months, so that's almost 10 years. The patients all had been treated and gone through studies. And of those 537 patients, 20% relapsed. So first of all, it's telling you 80% didn't relapse, so it's pretty good news for a lot of people.
80% is good odds. Could be better.
Could be better. If you're in the 80%, you feel pretty good. If you're in the 20%, you feel pretty sad.
Yeah, that's for sure.
And first of all, it's telling you, well, if you have cancer, this kind of cancer, B-cell lymphoma, most likely you're going to be cancer-free over that period of time. Because a lot of people out there don't really believe that you can be cured from cancer.
Right.
Once you have a cancer, you're doomed to die.
Is it ever really gone? Is it ever really cured?
Right. So you've got here a study that is diligently following almost 600 patients, and 80% are cancer-free. And 20% of them relapsed. Those are the sad news. That's the sad news. And then 41 died of other causes. So sometimes you don't think about if you have cancer.
There could be another underlying
You can have heart
issue.
disease or stroke or get hit by a car.
Sure.
So bad things can happen even if you have cancer. You can succumb to other causes. And there were, of the